I am Mohammed Hussain. I'm a cardiovascular medicine fellow physician at Advocate Aurora Health, St. Luke's Medical Center. It's my utmost pleasure to interview Dr. Samit Shah to discuss his research primary results of Discover INOCA. Please allow me the opportunity to introduce Dr. Samit Shah. Dr. Shah is an interventional cardiologist and clinical scientist. He did his MD and PhD degree at University of Illinois, and he did his medical residency cardiology fellowship and interventional cardiology fellowship at Hale New Haven Hospital. He's a highly accomplished clinical scientist and interventional cardiologist with a special interest in invasive coronary physiology and outcomes and evaluating outcomes of coronary interventions. And he is a highly accomplished scientist with many awards, including but not limited to the Sky 30 in their 30s award. Thank you so much for being with us, Dr. Shah.
Thanks, Mohammed. Thanks for having me.
So, Dr. Shah, can you tell us what made you think of the idea of doing this research and just a brief introduction to it, please?
Yeah, of course. So Discover INOCA started when I was in training. Like many of us, I saw patients coming into the cardiac cath lab with chest pain or other symptoms that made us think that they had something wrong in their hearts. But when we did their coronary angiogram, they had normal coronaries. And I think all of us have seen this over and over again, predominantly in women, but also in men as well. So as faculty at Yale, we started doing invasive coronary function testing around 2019. And we saw more and more patients coming in that we were able to give diagnoses to and then treat for these vasomotor disorders that were otherwise undiagnosed. And that was really the inspiration for Discover INOCA, which is a prospective multicenter registry study of 9 centers around the United States doing this same type of testing.
Perfect. And can you shed some light in terms of the outcomes of this study?
So the primary short-term endpoint, which is what we presented today, is the phenotypes that we diagnose when we do invasive coronary function testing. So using a standardized protocol, including coronary angiography, acetylcholine testing, bolus thermodilution with the ChoroFlow system, and intravascular imaging, we found that 94% of patients who came with suspected ischemic heart disease had a coronary vasomotor disorder. Of those, nearly 30 to 40% had coronary vasospasm, 30% had mixed disease with microvascular disease and vasospasm, and 17% of participants had coronary microvascular dysfunction. This is a big change. Of the patients they came in with their pre-procedure diagnosis, 89% had a change in their diagnosis after having this testing.
That's a big percentage, 94%. And it just tells us that we're probably missing a lot of patients that we could have diagnosed with microvascular dysfunction if the appropriate testing was done. What do you think are the barriers for doing these testing in the community settings, including the acetylcholine challenge and the other testing, the IMR and so on?
When we designed Discover INOCA, we wanted to design it pragmatically. It's a registry design based on participants having a clinically indicated referral for coronary angiography. This is different than previous studies that enrolled a research population. So we wanted to make it all comers that are coming to the cath lab already. And it's for this question, basically, is how do we scale this and make it available in other cath labs? And as we were launching sites for Discover INOCA, we came across some of the same barriers at each site. And so once we had operators that were invested in doing this, they had to get acetylcholine, which is how we test for endothelial dysfunction and vasospasm. And there's barriers with how people are able to get that through their hospital pharmacies. Sites had to have physiology testing equipment and pressure wires. And so that's currently the Abbott ChoroFlow system, but there's other devices that are now coming to market. And then they had to have the motivation to do these extra steps. And so we showed that this whole protocol from sheath insertion to sheath removal could be done in 60 minutes. There's 99% of people had the procedure done without any major complications. And there was a low rate of contrast use. It fits really well within a cath lab workflow. And I hope that Discover INOCA is able to take away some of the concerns that people might have had about whether they can do this in their centers.
I see. Yes, because there is a lot of fear, especially using acetylcholine, but your trial showed that the side effects are very, very low, and 99% of patients didn't have any complications. Do you think diagnosing these patients with microvascular dysfunction will improve their symptoms in terms of targeting treatment to treat their diseases specifically?
So the short-term endpoint also looked at 30-day change in the Seattle Angina Questionnaire Summary Score. And so what we see is with medication changes that happened in 72% of the total cohort, you see improvement in certain subgroups, including coronary vasospasm, mixed microvascular disease and vasospasm, and then other disorders like symptomatic myocardial bridging from baseline to 30 days. However, no significant improvement in microvascular dysfunction. And so you're seeing phenotypic heterogeneity in terms of how people do. Long-term follow-up is ongoing, and Discover INOCA was designed for 5 years of follow-up. And so we're continuing to see what happens over time with standard of care therapeutic interventions.
Are you also looking for outcomes in terms of MACE outcomes, for example, or are you targeting only symptoms?
Yes, and so the primary long-term endpoint of Discover INOCA pre-specified is major adverse cardiovascular events at 5 years. And so we expect to report interim analyses, but the study will not be complete until we have that long-term data.
And last question for you, Dr. Shah, where we'll be able to find the results of this trial? Are they going to be published?
So
soon?
you'll see the slides available through ACC Anywhere, but the manuscript is currently under review, and hopefully we'll share that with you soon.
Perfect. All right. Thank you so much, Dr. Shah. And if you guys want to review the similar interviews, please visit youtube.com/fitsonthego. Thank you.